Everyone talks about pregnancy and birth, but no one really talks about the postpartum period. You're just handed your newborn, given some painkillers, and shipped off home. Hey there, first time mamas. You're all welcome back to my YouTube channel. First of all, let's start with the basics. What exactly is the postpartum period? This is when you've had your baby till 12 weeks after you've had your baby. The postpartum period is also called the fourth trimester. This period is actually the most challenging for most moms. Don't worry, today we're going to be exploring this in detail. I'm going to be giving you the tips, the tricks, telling you what is normal, what isn't normal, what to expect, and so much more. We'll be going into what happens right after birth. After you've had your baby, there's something called the golden hour, and this is the period when you and your baby can bond. So the midwives or the doctor would bring your baby to you, and it's usually skin to skin bonding. So your baby is not clothed, you are not clothed. This kind of bonding helps to establish that connection between yourself and your baby. However, not all births follow this principle, because if you've had the CS, you would still be under the effects of anesthesia, so your baby might not be brought to you. And another thing that takes place in this golden hour is your healthcare providers will be giving you the medical attention you need. So let's say you've had tears, the midwives or the doctor would be stitching you, and if there are any other things that have gone on, they'll be giving you all the attention that you need during that period. So after you've had your baby, you might be thinking, yay, I'm done, yippee, everything is out. Let me bust your bubble there. Well, it's not all done, because there's still another very important part that needs to come out, and this is called the placenta. Now, if you've not heard of the placenta before, or you're wondering what this is, the placenta is actually what attaches your baby to yourself inside your womb, and your baby comes out usually without the placenta. So the placenta needs to be delivered. Yes, it sounds weird, I know, because your baby needs to be delivered and then it's like you're having another baby. Yes, think of it that way. They would give you some oxytocin. Oxytocin is a medication that helps the uterus to contract, and by contracting, your womb is releasing your baby and also releasing the placenta. Your midwife or your doctor will do what we call a fundal massage. Now, the uterus, it has like an upside down U. So at the top of the U is where it's called the fundus of your womb. So your midwife or your doctor will be massaging that area. It helps your womb contract, and this would help your womb to begin to shrink back gradually. It's a very, very gradual process. Yeah, we're coming to that later, but it's a very gradual process. It doesn't happen overnight, okay? After the placenta is delivered and there's fundal massage, you might have some blood tests. Most of the time, this is just to check your blood level, that's your PCV, to check if you've had a lot of blood loss and if you need some blood transfusion or medications to boost your blood level up. Okay, there might also be some other tests, like the basic tests. Your liver might be checked, your thyroid might be checked, your kidneys as well might be checked. So it actually depends on your circumstances and what you've actually gone through. Colostrum, colostrum is the first milk that your breasts release for your baby. It is very, very rich in nutrients. It is packed with a lot of essential things for your baby. If possible, you would want your baby to have this colostrum. All right, and when does this colostrum come out? It's usually within the first few days after birth. In fact, in some mothers, they might begin to produce colostrum even before their baby comes, usually within the last few weeks of pregnancy. It's usually yellowish in color, and it can be watery or it can be thick. You can store it in the freezer so that your baby can have enough to drink from. I remember expressing some colostrum just a few days before I had my baby, and I was able to have enough to give her when we got home. Okay, so the next thing is your first postpartum pee. Now, if no one has told you this, I am telling you that it's going to be sore, S-O-R-E. Believe me. When I had my baby, oh my gosh, it was hurting. Like, I was hurting so bad when I went to pee. There are some things that you can actually do to help to reduce the burning, stingy sensation. Okay, so this is what happens. You've just had your baby, so everywhere is sore and is like, argh. So when you go to pee, especially if your pee is concentrated, this creates a burning kind of sensation. It's very stingy. So first time mamas, one thing you want to do is try and drink enough water if you can before your first pee, just to help to dilute the urine, because the more water you drink, the less concentrated your urine is and the less stingy and burning sensation you're going to have when you go to pee. Okay, so when is the best time to pee after you've just had your baby? It's actually best between the first 4 to 6 hours. Okay, now if you're unable to pee, or if it's really difficult to pee, you need to inform your midwife, okay, that you've not been able to pee, and in fact they will even come to check on you. Okay, so there are some interventions that they might need to do, maybe pass a catheter. A catheter is a small tube that goes into the place where your pee comes out from, and they'll use this to monitor you, to check if you're actually producing enough urine for them to be satisfied and send you on your way home. And one very important thing that you need to do is try not to go to pee on your own. You might feel, yes, I've done it, I've pushed my baby, I'm fine. But sometimes there might be some dizziness. I don't know the stress that your body has gone through. Some moms have actually fainted. Yes. So you don't want to pass out after you've just had your baby because you're going to the bathroom to pee. It's best to call a midwife, your partner, a family member, whoever is around, to just assist you, or at least just be around while you go to pee. All right, now moving on to the first night with your baby. Yes, so your bundle of joy is here, and both of you, trust me, on that first day would be tired, exhausted. Their newborns are worn out, worn out, because they've gone through a lot, coming out into the world, into a strange place that they've never seen, they've never been. It's a lot for them. So that first night for most babies would be more of just sleeping, maybe waking up a few times to eat. But other than that, most babies tend to sleep. However, this period doesn't last forever. Okay, there is something called the second night syndrome. Yes, it's actually a thing. So the first night is mostly peaceful, but the second night, my baby dealt with me. My baby showed me shege. That's it. My baby showed me pepper that second night, because I was thinking, oh, my baby is a good sleeper. She didn't even really disturb. She was just sleeping. That was on the first night. Then we went to the second night and it was like boom shakalaka. So heads up, mamas. The second night can actually be more challenging, because that's when your baby realizes, oh, I'm no more in my mother's womb. I'm now in the world. Oh, yes. And then the hunger begins to set in, and diapers, them being wet, them needing to be changed, and attention. They want to be cuddled. They want to, if possible, they want to go back into your tummy. So be braced up for that, mamas. Moving on to lactation issues. So this particular point, it needs a whole video on its own, and I'm still going to make a video on that. Okay, so stay tuned for that video. Now, lactation issues are a major problem, especially if you are breastfeeding full time. Oh my gosh, no one told me the struggle of latching. I had serious challenges with latching, but thankfully the midwives and a lactation consultant really helped me. Thanks to my elder sister, she told me that when she had her own baby, she had a very challenging time with lactation and latching and all of that. So she told me I shouldn't leave the hospital unless I have spoken with a lactation consultant and they have shown me everything and I'm satisfied that, oh yes, when I get home I can continue breastfeeding. And that was actually what I did. I refused to go home. I said, I'm not leaving until you bring the lactation consultant to me, because these breasts are going to breastfeed my baby. And I don't know how I'm going to do it. I've tried and it's not going well. So I need help. They actually brought the lactation consultant and she was really helpful. So this was what I did, because I had cracked nipples. I had sore nipples. Yeah, I think I was even bleeding a little bit from my left nipple. And it was very challenging. I was in so much pain. I didn't know that this thing could cause so much pain. When you see mothers breastfeeding, you're like, oh, it's just to put your baby, and your baby just automatically latches on. Reality check, your baby doesn't automatically latch. Oh, I said it deserves a whole video on its own, okay? So, this is what I want you to do, mamas. If you can, if there's a lactation consultant in your hospital or where you are, please let them assist you, okay? Yeah, I was talking about what I did, right? So, I had to stop breastfeeding, but I was pumping and I was feeding my baby with formula. Now, this was for the first 9 days, because by the 10th day, my nipples were fully recovered. They were happy. My baby was happy to latch on by that time. So, if this is what you want to do, you want to give your baby formula while your nipples breathe and rest, then you can. And then once they are healed, you can continue breastfeeding your baby. However, you don't want to over pump, because when you overpump your breasts, it's going to send a lot of signals to your body, and your body is going to be in full-on breast milk production mode, and this will lead to more engorged breasts and more even lactation problems. Overproduction is actually a thing, so you want to just pump enough. Yeah, I'll make another video about that, about pumping. And if you want me to, just let me know in the comment section. If you have any questions, just let me know in the comment section. We'll be moving on to the 10th point: understanding postpartum bleeding. Postpartum bleeding is actually called Lochia. Your womb is shedding all of the tissue, everything. It's just trying to bring out all the blood. It's divided into 3 phases. I've put the color code that you could expect, okay, and all the important things that you need to know in this picture here. The first few days would be what we call Lochia rubra. That's red, okay, the blood will be red, and you have more clots, you would have more cramping. This is your womb contracting just to bring out the remaining products that might be there, the tissues and everything that might still be in your womb. We have the pinkish brown, and this is usually from days 4 to 12. Okay, you have lesser cramping, lesser clots by this time, if any at all. And then by the 12th to 28th day, there should be more of a yellowish kind of color. It could be white in color. There shouldn't be any clots at this time, and no cramping at all should be by this time. So if you're still experiencing clots, this is a red flag. It is a sign that something is actually wrong, and you would need to speak to your healthcare provider. There are some other red flags I want you to watch out for. If you're having a high temperature that is over 38 degrees centigrade, if you notice pain in your tummy that is not resolving, it's constantly there. If you notice any foul smell from your lochia, let's say you had stitches and they're breaking down, is a sign that there could be an infection. These are some red flags or some signs that there could be something wrong with your body, and you need to go to the hospital for them to check you out. So there you have it, mamas. These are the most important things that you need to know during those first few hours after you've just had your baby. It's a 4-part series, and this is just the first one. I have so much more information in the other videos. Please don't forget to like this video so that I can reach more people out there, more first-time moms out there. Subscribe, turn on post notifications, and share. Thank you so much for watching, guys. You see more of me in my next videos. Bye.